grant exceptions, waive the provisions, or expand a nurse's role. Each state's Nurse Practice Act sets the educational and examination requirements for licensing in that state. The Nurse Practice Act identifies the functions of each category of nurse that practices in that state, and it establishes a board of nursing. The Board of Nursing ensures that those individuals who practice nursing are licensed to practice in that state and prevents those who do not meet the requirements from practicing nursing. Each nurse must know the pertinent state laws and use the Nurse Practice Act for guidance and appropriate action. Nurses functioning in supervisory positions are responsible for monitoring the practice of the employees and for ensuring that staff maintain current and valid licensure. Institutions may restrict the activities permitted by a specific category of nurses, but they cannot expand them. Here's an example of a nurse supervisor explaining hospital policy to a new RN employee. You've asked if there are any limitations beyond the state's Nurse Practice Act. Yes, there are. You'll be working with some practical nurses. Although our state's Nurse Practice Act allows practical nurses to perform assessments, the hospital requires that a registered nurse assess each client each shift. In addition, practical nurses are not allowed to administer intravenous medicine at this hospital, and that includes practical nurses who are certified to give IV medications. Our hospital has decided that only RNs will give IV medicines. So, to follow hospital policy, you'll assess every client and administer all IV medicines to the clients in your care. Nurses are sometimes asked to perform procedures that are unfamiliar to them. If you are in this position, there are some guidelines to help you determine your actions. Clarify, assess, identify options, point of decision. First, clarify what is being asked of you. Are there written policies and procedures? Do other nurses in your healthcare agency perform this procedure? Do other nurses in the region perform the procedure? Does the procedure require professional judgment, or is it simply a new skill? Next, assess your competence in performing the task. Do you currently have the knowledge and skills to perform the procedure? Do you believe you will be able to learn the required skills in the allotted time? Is the procedure within your scope of practice? Then, identify options and implications of your decision. First, determine if the task is prohibited by the state's Nurse Practice Act. If so, you will have to refuse to perform the task. If the task is permitted, you will have to determine whether you can provide safe client care with your current knowledge or if you will need additional education and skill practice. If you accept the new responsibility, you will be ethically and legally responsible for performing the new procedure at an acceptable level of competence. Now you are at the point of decision. There are several directions you might take. You might decide that there are no major scope of practice issues and that the educational requirements are reasonable. Or you might decide that the procedure is complex and will require a detailed implementation plan, including changing policies and involving other departments. Another option might be to refuse the request to learn to perform the new procedure. In that case, you might need to make an appointment with the supervisor to discuss your decision and to document the rationale for your decision, identifying the benefits and risks. Each nurse must determine his or her own scope of practice. To determine your scope of practice, you must understand the Nurse Practice Act in the state where you practice. Other resources are the Standards of Professional Organizations, the American Nurses Association's Code for Nurses, and the Particular Employers Policies and Procedures Manual. However, the Nurse Practice Act serves as the legal definition of nursing and outlines the parameters that indicate deviation from or violation of the law. Since each nurse is responsible for knowing the legal limits of practice, there are some terms we need to discuss. Liability defines each person's responsibility and accountability for individual actions or omissions. Even if others can be held accountable, each person retains accountability for his or her actions. In addition to each person's responsibility, employers are accountable for the actions of their employees. This is known as the doctrine of respondeat superior. However, this does not protect the nurse from also being sued. The institution is also responsible for maintaining an environment that ensures quality healthcare delivery for consumers. This includes providing qualified, competent, and adequate staff. Therefore, the institution must show that its nurses are competent. To prove nurses' competence, institutions often require nurses to demonstrate annually that they can perform certain skills. Negligence means that the nurse provided care that did not meet standards. The nurse's actions are compared with what a competent, prudent nurse with similar educational preparation would do. Malpractice is a negligent act performed by a person in a professional role that results in injury. For malpractice to be proven, 4 elements must be present. First, a duty must be owed to the client. This is established by showing that the nurse is employed by the institution. Then, a breach of duty must occur. This involves failure to follow established standards of care. Third, the client must be harmed. The action or omission must directly cause the client harm. Finally, the action must result in physical injury. Emotional or psychological injury is not enough to prove malpractice. If all 4 elements are not met, malpractice did not occur. For example, a nurse administers the wrong medication to a client because she did not read the client's armband. The nurse has a duty to administer only prescribed medication to the client. The nurse committed a breach of duty when she gave the client the wrong medication. However, if the client was not harmed, the nurse is not guilty of malpractice. She is guilty of negligence, however, because she did not follow the correct protocol. Sometimes a client is injured, but the injury was not a result of the nurse's action. Again, malpractice cannot be proven. So, as you can see, all 4 elements must be present for a nurse's actions to be considered malpractice. Assault is the attempt or threat to touch another person without justification. Nurses may be accused of assault by threatening to force a person to take medication or to eat. Battery is intentional contact with a person or with an object the person is holding or wearing. The touching must be harmful or embarrassing in some way. A nurse who continues to perform a procedure after being asked to stop could be at risk for a charge of battery. False imprisonment involves restraining or detaining a person against his or her will. Physical restraints are not necessary for a situation to be considered false imprisonment. A nurse who tries to detain a client who wishes to leave against medical advice might be practicing false imprisonment. In addition to the above legal terms, there are other situations that place a nurse at risk for a lawsuit. Let's review some of the more common areas that place nurses at risk. Areas of risk for lawsuits: loss of property, invasion of privacy, failure to report client abuse, failure to report unsafe healthcare providers, poor documentation, and failure to follow a physician's orders. Nurses are responsible for protecting the client's valuables. Each institution has a policy describing how valuables are managed. It is essential that nurses document what valuables the client has and how each valuable item was managed, for example, locked in a safe, left in the client's room, or sent home with the client's family. For their own protection, nurses must document the name of the person taking the client's items home. Invasion of privacy involves confidentiality and intrusion into personal space. Clients have the right to expect all information shared during their care to be kept confidential and not disclosed to anyone who is not directly involved in the client's care. Clients also have the right to determine what is done to them and by whom. Federal law mandates reporting of suspected child abuse. Most states also have laws requiring the reporting of cases of sexually transmitted diseases, as well as abuse of residents in nursing and convalescent homes. Each healthcare agency has a policy describing how to report suspected abuse. Nurses must know where to find the policy so that they can follow the appropriate reporting protocol. Should the suspicion of abuse be unfounded, nurses are protected from prosecution. In addition, nurses must be aware of situations that place them at risk for an accusation.